teacher education, and this is what I am going to be discussing with you. So thank you all again. Just look at this image. Once both the ways it can be constructed. So the planned construction is what you are seeing in the second image. Learner is the focus on education activity. That is, the students are to be the central point of any education activity. To make this happen, there are two models of teaching. This is one model where you can see the teacher trying to force feed the student with whatever knowledge he or she has, and the students have to be passive recipients. Many of us are experienced in this, and there is a second model where the teacher is trying to facilitate and support learning. If the student has to be the focus on education activity, which model? The first or the second? First or no response? Second, yeah, exactly. And it is this model that the national education policy also expects the educators to implement, so that the learners are empowered and enabled as professionals. With this in the background, what are the requirements that we need to have for a teacher preparedness? What are the requirements for teacher preparedness in any educational policy implementation? Now, when we talk of this, one thing that we have to remember, whether it is a teacher or a student, any professional must have competency. Any learning has to be competency based. The competency is defined as the habitual and judicious use of certain attributes. These attributes include communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection, and these have to be in the daily practice for the benefit of individuals and communities that are being served. This is what is the definition of competency. So when we talk of competency, there are some taxonomies for competency, some classification of competency. How does competency develop from somebody who does not know anything to the area where somebody becomes an expert? The tool that we use for this is called as Dreyfus competency tool, designed by two brothers, Dreyfus and Dreyfus, to improve the competency of US Air Force long time back. So the same model we are now using in education and training to bring about an understanding of how to shift the levels of competency, how to improve the levels of competency among the students. The first level is where the student is novice, where the student does not know anything, has to be told everything. You are a first year student who does not know anything. Once the student starts learning something, the next level is called beginner level or advanced beginner level. In the advanced beginner level, the student has some idea but has to have a kind of support from the teacher or mentor for performing. The third level is called competent, where the student becomes competent and independent in performing certain things which are listed for that level of learning. Once a person becomes competent, the next level of expertise that one has to achieve for is called proficient, The difference between proficient and competent is that a person who is proficient is competent but is also economical. For example, if a competent person can complete a task in about 20 minutes, a proficient person can do the same task in about 10 or 15 minutes. That is the difference. And finally, you have the person who is an expert. Expert is the one who can relate knowledge and skills which are learned in a different area into another area. The person who can relate from different zone into a different zone. So this is the taxonomy of competency which the trainers inculcate, and in fact this is what we have been including into the designing of curriculum. Maybe in our curricula this will become the norm. So what is that is required for this competency level of training to become normalized into the entire education system? There are certain things which are required. I will be presenting to you in very brief manner. First thing that you require is to have faculty sensitization and development. The teachers of any education system have to be trained in the area of education methodology. What is now happening is, if you have teachers in pharmacy or in dentistry or medicine, these teachers come with their professional qualifications. They may have M.Pharm, PhD, MDS, MD, whatever. But these teachers do not have a formal training to be a teacher. What are the requirements to be a teacher, how to conduct teaching, how to conduct student assessment? These are the areas which are lacking in the current post-graduation of any professional education, except maybe nursing. So faculty development sensitization is an important thing. Second thing that we have to do is called as administration and governance. Understanding, so teacher is not only a person who gets into the classroom and teaches. They also have the other duties of governance and administration that teachers have to have that kind of training also. And the third is, we have to condition the students for professionalism. I'm not saying that students are not professional, but the professional attitudes also include a whole lot of soft skills. The industry experts will explain to you later how your hard knowledge or hard skills are not sufficient for you to succeed in any area. It is the soft skills which are almost 70% which are required. Hard skills anybody can acquire, but soft skills you need to have an attitude. Unless you don't have that attitude and a professional behavior, you cannot succeed in life. So conditioning for professionalism, and the last one is called continuing professional development. Once you complete your professional courses, B.Pharm, M.Pharm, whatever it is, it's not the end of your learning journey. You need to have a continual upgradation of your skills and your knowledge. So it is what is continuing professional development. For all these things, in the education stream, there is something called as curriculum or a system. This curriculum or system in education consists of three components. One is called as, what is the purpose of this learning? What is the purpose of education? What are the learning goals? After completing B.Pharm, what do you expect the student to perform? After completing the first year B.Pharm, what do you expect the student to perform? After completing this particular class, what do you expect the student to perform? So these are called as learning goals. Learning goals are listed on what the learner will be able to do. This is what we discussed earlier. Learner is the focus of all education activity. So all the learning goals are written as learner-centric, what the learner will be able to perform. So once you read these learning goals, what is the facility for the students to be able to perform it? These are called as instructional activities. Whatever you get into the classroom, laboratories and community, what are the learning activities? And the third thing is, how do you know that the student has learned this or acquired this competency? Is by conducting an assessment, and these three components are interlinked. You can see the arrows are pointing both the sides. And then we have specific learning outcomes which are listed with certain features that whenever we say this is a learning objective, these objectives need to have certain features like relevance, feasibility, validity, observability, clarity and measurability. And then prioritization of learning. It says this is the level of learning for the entire B.Pharm course. This is for the level in first year course, and this is for say pharmaceutical chemistry, and finally, which is most important to learn and not just very important to learn. The further prioritization as must know, desirable to know, nice to know. These are the about 5-6 tools which are used for designing a curriculum. Now, once you have designed the curriculum, the next level is implementation of that curriculum. In the implementation level, first thing is you have to understand who our learners are. There are some adult learning principles which are very important. And then, how do we classify which is the most appropriate teaching method? The majority of the times we see lecture is a teaching method, preferred teaching method, but lecture is not the only teaching method, and it is not sufficient for every level or aspect of learning. Therefore, there are certain factors which influence the selection of the most appropriate learning method, which I have listed there as a classification. And then I also have classified these on the scale of what is mostly learner-centric, what is mostly teacher-centric, and also depending on the size of the class, where the size of class is more or less. Based on this, we can select which is the most appropriate learning method, and then what is the medium that we use. On what basis we select the medium? There are some tools, and the classification of media can be either projected media or non-projected media. Most of you are familiar with this projection. They are also familiar with the non-projected media, like whatever is used in your laboratories, your equipment, your models, your specimens. These don't need any projection. So majorly two kinds of media. So this is about the implementation level. What are the tools for implementing the curriculum that we have designed? The third is for evaluation of the learning, which is the assessment. For assessment, the tools are, what are the types of assessment? We have formative assessment, we have summative assessment. Formative is something you continuously conduct, and summative is what happens in the university examination or your term and examinations. Then you have what are the methods? Which are direct method where you can observe the student performing, and indirect method where the students have already performed. For example, written test with the teachers do the assessment little later. Then there are some qualities and attributes of the question tool or assessment tools which are listed there. These need to be specific, practical, objective, reliable, and valid. And the specific tools for specific situations. Like for example, if you want to test the knowledge of the student, what are the tools which are listed there? If you want to test the skills of the student, those are listed there. If you want to test what is the values or attitudes or communication, there are separate tools for it. So these are all the tools that we require for the teacher education. So when we talk of new education policy, national education policy, let me make a differentiation between the traditional curriculum and the new curriculum and a competency-based curriculum. In a traditional curriculum, you have the teaching activities. You have these are the things which need to touch. This is the content which has to be given to the student. For that, we say this is the outcome. We expect the student to be able to do this, and for that we have the assessment. This is what is called as transmission learning. Transmission model. Like you have a transmission, you receive your signals for it. It only transmits the signals from one to another. It doesn't do anything else. So the teacher is transmitting the knowledge from the books to the students. Nothing is happening in between. So this is called transmission model, which is the traditional model. Then we have the competency-based model, where we list what are the expected outcomes the student has to perform, what are the professional roles the student is expected to perform. State those professional roles. On the basis of that, you decide what are the outcomes you expect, what are the objectives, basing on the tasks, professional tasks, and these professional tasks are assessed. You write what is the appropriate assessment for this. After you write the assessment of this, you start the teaching. You don't teach and assess. You design what is the appropriate assessment, or is it accessible? Can we make the assessment? And only then that becomes part of the curriculum. And this is called as transformation model, where the students are transformed from a novice to an expert. So these are the two models of curriculum design that we have. And to develop this, we need to have a collegial atmosphere for the growth of teachers and institutions. For this, there is a book called Fifth Discipline, written by management expert Peter Senge, and he says there are 5 areas that we need to develop or design into any system, whether it is marketing, whether it is teaching, whether it is branding, whatever it is, we need to have 5 areas for any learning organization. We call it learning organization. It is called, I will not explain this more, I just list them out. Systems thinking, team learning, shared vision, mental models, and personal mastery. These are the 5 areas which if you develop, even at the personal level. One thing that you can do is later after these sessions are over towards evening, and once you have relaxed much, you can just go on Google for 5th discipline or learning organization. You will get some reading material, short reading material, maybe 10, 12 lines also you will get. Just go through that and try to relate that to yourself. You will get some kind of an inspiration to get ideas for success in this. What are the things that you can do in this? What is that is possible at personal level for you? So with that, I end with a quotation. A good leader inspires people to have confidence in the leader. A great leader inspires people to have confidence in themselves. You can replace the word leader with a teacher and then read it again. A good teacher inspires students to have confidence in the teacher, and a great teacher inspires students to have confidence in themselves. So we need to have great teachers, great students, great professionals. Thank you.
Thank you, sir. Any questions from the audience? No? Okay. We'll move on then.
Now, it's time for the second speaker of the day, Dr. Sangamesh Puranik, founder and CEO, SASKIA Labs Private Limited, Bangalore. I request sir to come on the dais. Dr. Sangamesh Puranik, founder and CEO, SASKIA Labs Private Limited, Bangalore. Sir is having 21 years plus experience in various fields of pharma, food quality and regulatory affairs. His expertise is in market authorization, applications, small molecules, novel biological, biosimilar products, CT applications, food and dietary health supplements, controlled drug substances. Sir has completed his MPharm in pharmaceutical analysis from HKES College of Pharmacy, Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka, and MBA from Indira Gandhi National Open University. Sir has also done post-graduation diploma in regulatory affairs, intellectual property rights law, clinical research. Sir has also done PhD in quality assurance from Al Amin College of Pharmacy, Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka. Sir is the founder and program director, Drishti Institute of Distance Learning, Bangalore, since 2011. Sir is also the founder and CEO, Masanga Laboratories Private Limited, founder and director of SASKIA Labs Private Limited, founder and director of Thiagro Labs Private Limited. Sir has also worked as head of regulatory affairs and from Bioscience Private Limited from 2015 to 2020. Sir also serves as the president of Association of Regulatory Affairs Professionals, New Delhi. He is a member of APTI, Farm Association, etc. We welcome you, sir. Sir will speak on the topic NEP and its impact on future of pharmacy.
Good afternoon all. So I am very happy to be here for the second time. I hope last month also I am here with you on talking on certain topic. Today we are blessed to be here on the great occasion of our father of pharmacy, Dr. Mahadeva Lal Schroff sir, on his birth anniversary, 121st birth anniversary, regarded as the National Pharmacy Education Day. And every year, and congratulations to Oxford College of Pharmacy. It is the first institute in Karnataka selected for PCI, and one more is in Diamond Center. And congratulations once again. So today we discuss what is the importance of National Education Policy 2020, how it will be useful for our pharma field. Before starting any journey, I want to say one quote. The road of success is always under construction. The road of success is always under construction. If you want to build a successful road, you should have A, B, C, D. A is ability, B is belief, C is commitment, and D is dedication. If you have all these four things, so you can do whatever you want in your life. See, don't think starting anything new or it is a very big impact. See, already the whole world knows India is the pharmacy of the world, and we have proved it once again during the pandemic, COVID pandemic. The whole world knows the capability of pharma sectors of India. So we are the only one who has given the vaccine to the entire developing nations and small countries. Wherever our so-called Western nations, they developed the Covishield. Ours is Covaxin. There is a lot of tug-of-war between doing the approval of our Covaxin. Covishield, even though they have developed and approved in India only for emergency treatment, but their conditions were not fair. That is why our beloved Prime Minister Narendra Modi has taken a great step. Let us struggle for a few months, and we have been blessed with our yoga and our Ayush medicines. India is the best country always. So everybody look into India. Whenever there is emergency in the whole world, they look to India for the solutions. We are such a great country, and we should be proud of that. And we pharmacists is one more feather on our cap. Pharmacists, see, there was an event when I was attending that one. There were a lot of doctors were there and pharmacists, because doctors use life to the patients with the help of drug, but we pharmacists use the life to the drug itself. So only in India, due to the advent of NPG, we will get the respect as that of the Western pharmacists very soon. Even though we have thorough knowledge about the pharmacy because of MCA, Medical Council of India, and other factors, we are not treated well in India, but our time has come now. We have to prove it. We should have thorough knowledge about the pharma products. Mainly, pharmacy means very, very noble profession, and we should have thorough knowledge. That is very, very important. Being only a pharmacy for the world doesn't matter, but we have to be very, very competent in being all our community pharmacy, patient compliance. Our new areas are there now, pharmacovigilance, data safety management, CDMA. Majority of the pharma companies, we are giving jobs to the software people, so-called computer science people, artificial people, whatever is there, they depend on the pharma companies. Take any top software companies, it may be TCS, Accenture, HCL, Cognizant, the kind of thinking, they are dependent upon pharma companies' projects, mainly in case of pharmacovigilance, clinical trial data management, and they are doing lot of work for them. They are thinking, see, without pharma is an evergreen field. We should be happy with that. Whenever emergency is there, people look to pharmacy people, not to software people. Software only when everything is fine, you can look up the software things. So pharma is evergreen and needed for the entire country during the any type of pandemic, pharma is required. Today, let us focus to the topic. Can you go to the next slide? Pharmacy Council of India, this NEP, National Education Policy 2020 has been enforced, and it will be start from 2023 and it will be everywhere. So already for pharmacy people, it will be very easy to implement this new education policy because we have a lot of guiding codes that is PCI is there, Pharmacy Council of India. Already our syllabus is regulated by PCI. Whole nation is having the uniform syllabus. It will be easy for us to implement National Education Policy rules, and we will be guided by PCI and our individual state, local authorities, the total department is there, our own pharma industries are there to guide us. Then we have PharmD abbreviations, diploma, pharmacy, B.Pharm, M.Pharm. So, and recently they have implemented diploma in pharmacy exit examination. With implementation of National Education Policy 2020, there is very much chances of diploma courses will lose the importance very soon, because in the new education policy, if you continue pharmacy education for 2 years, you will be awarded diploma in pharmacy. If you continue for another 1 year, for 3 years, you will be awarded an advanced diploma in pharmacy. If you continue the education for 4 years, you will be awarded as B.Pharm. Then, within a year, if you go for research, you will be awarded as PG, postgraduate in research. Now, they are coming up with various new titles. Everybody knows after B.Pharm, M.Pharm, everybody calls it a pharmacist. That title will be only for diploma holders. In future, the diploma holders will be having as a pharmacist. When they complete B.Pharm, they will come out as a B.Pharm in pharmacology, B.Pharm in pharmaceutics. If you come with some other degree, they will call it a pharmacist, it will be a specialist. It will be called PhD honors, B.Pharm honors or B.Pharm research. If you are research oriented, your degree will be awarded in research, B.Pharm research, or in any, if you are in regulatory affairs, in clinical trials, pharmacovigilance, each and every course will be specialized in new type of degree. See, actually, the pharmacy started from chemistry. Any chemical entity can be classified as a pharmaceutical or an agrochemical. If it is having a pharmacological activity, it is called as a pharmaceutical. After that, it has to undergo various preclinical trials, animal studies, then it can be classified as a pharmaceutical. Once the toxicology report gives the promising results, then we can go for clinical trials, phase 1, phase 2, phase 3. So that is how the chemical entity can be converted into pharmaceuticals. There is a three-dimensional approach in pharmacy. The entire pharmacy is divided into 3 fields: pharmaceutical sciences, pharmacy, and pharmacy education. Pharmacy education plays very important role because you are the teachers, pharmacy teachers are the ones who educate any type of people, and later on they will become the industry specialist, the clinical specialist, they may become entrepreneurs, startup culture. So lot of things, because you are here, whatever we learn in the college days, it's very, very important. Learn with a lot of interest and you can interact with your teachers, there are a lot of opportunities to collaborate, industry academia collaboration. You can go for research in your degree, final year degree levels. So being in Bangalore and metro cities, you are blessed. There are lots of industries in and around. For your research project, you can go directly to the industries with your teachers or principals' permission, then definitely you can get a job opportunity in an industry. So you have to utilize it in the proper way. See, nowadays education, I think education has become very, very interesting as well as difficult for teachers to manage the students because it is loaded with full of information. We should know how to utilize that information because it is very challenging for the teachers because now the entire thing has been changed. In the fingertip, we get all the information. So we should know how to take advantage of that and go to the next level. National Pharmacy Commission. The entire pharma industry has developed, has four trends. In the 18th century, it is mechanization, industrial growth happened. But in the 19th century, there is mass production with the advent of electricity and all those things. There is huge mass production which can be utilized for the domestic purpose and for the export purpose. And in the 20th century, lot of changes happened. Automation, computerization and robotics, which will take care of all type of manufacturing. See, every adversity comes with equal opportunity. Due to the advent of artificial intelligence, robotics, automation, in manufacturing, there is very less human interaction in this right now. If you train robotics, already in Bangalore, Indus school, I think, they got robotics. One robotics can do the work of 10 teachers. So even being a teachers and pharmacists, we should think alternate what best we can do other than teaching. Because it is a challenging time, not only for the teachers, students, whole world is facing the challenge. Recently, our who is our Google CEO, he is also facing some challenges due to artificial intelligence. They are not implemented their app Gemini in the proper way. So everywhere you go, lot of adverse things are happening, but we should think in the positive way and we have to move on. We should know how to utilize it in the proper way. Then the fourth generation, we are in the digital edition. Everything is digitalized. Then big data analytics, replacement of administrators already in practicals. There is no need of vendor models now. Everything is software. You can use it. Then in digital therapy, flexible production, computational pharmacy, gene therapy, the whole system is changing now. And even it is personalized gene therapy or personalized treatment is there. Each individual will study the gene structure of your body, then they use the personalized medicine. Each individual are treated separately. So even the pharmacist is a big challenge. We have to upgrade ourselves to overcome all the events. Then even IoT, the internet, everywhere information is there. IoT, the internet things describes the network of physical objects that are embedded with sensors, software, all the medical devices like your glucometer and all those things. Everything is digitalized now. Even the thermometers, whatever you take, everything is digitalized. Even recently, one of my friends was about to come, Naresh Ashija, who was the global head of Tata Medical Devices. They have launched a handycam like that X-ray machine. No need of in light only they can take a photo and you get X-ray. It is a handicap. Just like your handicap, X-ray machines are there. No need of dark room, no need of plates, nothing. There is a Korean company who has introduced. So lot of changes are happening. One mobile has replaced your watch, your camera, so many things. So many things have done. Now this advent of new things, this is the entire old systems and old models. So even robotics, artificial intelligence to replace teachers, human beings. So we should use the creative part of our brain and we should know how to utilize all these advancements. Key changes. What are the changes which we face in the future? which is well equipped with all this knowledge, that is artificial intelligence, and we should have a three-dimensional way of thinking, that is creative thinking, intellectual growth, and problem solving. You should know if any problem is there, you should know how to solve it. Problem solving is very, very important area. Whatever the problems come to you, do instead problems comes with equal opportunity, and it comes with a seed of solution. We have to change the view of the problem. See, always first solution starts, then the problem. So from that side, if you have our eyes open, we have to think out of the box and we can find a solution. Then learn how to handle your mind. Because lots of information is available in the internet. In your phone, it is a very, very horrible thing what you are carrying with you. It has a lot of positives and negatives. So you should know how to handle it properly. You have to use emotional quotient, IQ is there. Lot of people, we should know how to learn work with people. Nowadays, software people due to chat GPT and other artificial, and nobody is talking to each other now. Especially software people, even when they are sitting, they won't call, just will send a message, SMS and chat. So that you should avoid. Human relations are best relations. You should have all those things. Because of that, lot of students, school going kids are having a lot of stress and all those things. So it is the responsibility of, see, we are blessed to have a, we are the youngest country in the world. The whole world is looking towards India, and next 30 years we will be the youngest country in the world. We have a lot of challenges and opportunities. We have to use our talents in the right way. Since for that we have got a very good opportunity, national education policy. We can study whatever you want. Now, in B.Pharm you can join, you can start with that. 2 years you can learn, you can exit, you can go for any other course. If you want to do MBA, you can do that. Or if you want to learn after 2 years, one thing you can come and join. Multiple exit entries, earlier it was not there. Now, we have lot of options. See, now, so that is the very, very important thing of national education policy, and pharmacy, we can use it in multiple ways. We can use MBA, we can use LLB, Dr. Karvekar sir rightly told. Having B.Pharm, MBA, LLB, see, I'll tell you why these things are required. Whatever the Drug and Cosmetic Act is full of law, whatever patents, IPR is full of law. So, pharmacy is well connected with the law. BU whatsoever high will be recorded. So, and learn that change management. Lot of changes will happen, adopt and evolve. You have to undergo the law. What are the changes come? You have to take in the positive spirit and you have to move on. Then, national education policy. What are the fundamental changes? Teachers and faculty as the heart of learning process. First, train the trainer. Teachers will be taught first how to implement this new regulations. Then you can involve the students. Then it's very, very interesting for both teachers as well as the students. Outstanding research as a core requisite for outstanding education and development. Continuous review of progress based on sustained research and regular assessment. Like you are not, it is not like your regular exams, writing certain exams and assessment. Assessment can be done continuously. So these are all the improved version of your regular teaching skills. Students will be taught at a young age the importance of doing what is right and will be given a logical framework for making ethical decisions. Some of the major problems which may be faced, not exactly problem, but how to overcome. We have to think how to overcome all these challenges. Limited teachers and institutions autonomy, inadequate mechanism for merit-based career management, less emphasis on research at most universities and colleges. See, academics and industry collaboration is very much required in Western countries, in US and other countries. They will use, because all those universities are funded by the government, whatever the research and data generated in the academics, will be taken by the industries as it is, and it can be taken to the next level. They will do all the research development, they will do the preclinical studies, next year take to the clinical trial phase, and they know the value of patent in both. Now here they will involve both the academics as well as the industry people in the patent also. They can take your name as academician in the as a co-investigator and principal investigator. So even the benefit sharing ratio is also very clear. So in India also very soon on majority of the colleges they started memorandum agreements, MOU with many institutions in pharma sector. And as with Biocon, we had MOU with Alameda College of Pharmacy, where we did all the preclinical trials in Alameda College of Pharmacy. Almost all the insulin and insulin analogs, maybe oral insulin, almost all the clinical trials were done in academic institute in the Alameda College of Pharmacy. So if you have a good setup of R&D institute, R&D research lab, if resource persons are good, if they tie with industry, definitely you get a very good project from the industry. You can train your students, and you can also, one of the best culture, you can have your own startup in your own colleges. You can assign the interested students, and you can run both industry academic collaboration in your own institutes. Then an ineffective regulatory system largely affecting industry. These may be problems which can be addressed later stage. Now, what are the policies? Moving towards multidisciplinary undergraduate education. In BPharm only, you can learn n number of specialized subjects. Lateral options will be there. You can exit. If you don't want, you can enter, re-exit. Multiple options are there. Many times you can do it. Whenever you're not interested in pharmacy, you can go for management course. You can come back. You can complete. So that is the beauty of all these new national education policy. And light but tight regulations by a single regulator of higher education. The higher education society will give all the regulations, norms to you. You can take a decision. Now the decision is left to the learners, not the teachers. Whatever you want, you can learn. We are here to support you. Even the education policy wants you to learn whatever your interesting subject. It's not compulsory. Even in CBSE, ICS, also no need to learn PCI combination. You can take chemistry, biology with economics, political science. If you are interested in accounting, all combinations, all art, humanity, science, and commerce can be clubbed at any time. You can take all those things. You can make your careers very beautiful now. It is not compulsory, whatever is there, but you can choose your syllabus of interest. Increase access and equity inclusion. Then now this national education policy is open to the open online education system and open distance learning system and all infrastructure and learning material accessible to the available students. See, you can do any number of courses at a time. If you are really interested, you can pursue your degree BPharm along with other online courses like your pharmacovigilance, regulatory, IPR, whatever is available in the national education policy. Simultaneously, you can do some online courses, offline courses. Definitely, it will help in the industry to go to the next level. Research is also improved and enhanced through holistic and multidisciplinary approach. Large multidisciplinary universities and colleges will facilitate towards high quality, holistic and multidisciplinary education. You can do, see, during your BPharm career only, you can do research with the industry. The last 8 semester, you can go to any industry of your interest. It may be in analytical fields, it may be clinical trials, it may be research and development. Wherever you want, you can go to industry or you can collaborate with the industry and perform your project work. And immediately you come to know what industry needs from you, then you will be industry ready. So the main intention of new education policy is to make you immediately after your graduation, you will be ready to be observed by the pharma industry. That is the main intention of new education policy. Students, all of higher education institutions will be provided with opportunities of an internship with local industries, business, artistic, craft, any type of work. See, you can differentiate. You can be a pharmacy student, along with that you can do other courses also, which are relevant to pharmacy also. So that is the options which are given in the national education policy. Based on your interests, you can go for a number of multiple choices are there. It is critical that higher education institutions take a lead, undertake research in areas in the different areas like infectious diseases, epidemiology, virology. If you are interested in developing any type of medical devices or kits, you can involve during your B.Pharm 8th semester. So these are all the options given to the new batch students. We have all these options. You are blessed to have all the things. We have 20-day syllabus which was framed in the old regulations. You are blessed with all these options. Thanks to Director Modi, he has given a lot of importance to the youngsters and he has framed such a good regulations and education policy so that the youngsters can do whatever they want and whatever they are good at. It is not by force. You should select whatever your interested area. You can change. Now there is no force from your parents or the teachers. It is your wish. Whatever you want to learn, you can learn by sitting in your home through online courses or distance learning mode. Everything is available in the new education policy. To realize the impact of NEP on pharmacy, and initiative is taken by considering all the facts. The guidelines, syllabus for practice schools, even in B.Pharm level only, we can implement all these things. It is a blessing for all the pharma students because no, very easily we can implement because they have undergone rigorous changes from the PCI, local universities, your account department, local authorities, regulatory implementation of NP, that is National Education Policy in pharmacy, is very easy. So, basic concepts of methodology and preparation of, in the final year only you can tie up with all analytical implementations. You can go for the analytical method development direction. The basic research methodology will teach you how to make your synopsis, dissertation, thesis, all those things. You used to learn on the PG level only, but now in degree level B.Pharm only you can do all those things. Immediately you can start. Now, no need to complete your degree, PG, then PhD. 4 years M.Pharm, B.Pharm plus 1 year M.Pharm, directly you can go for PhD. Earlier it was very tough. Now the NEET rules very simplified. If you are interested, simultaneously you can go for integrated courses also. So that is the beauty of the new education policy. And care your health and service of community. One more beautiful step is steps to the entrepreneur and startup. If you have any idea, lot of emphasis is given for the startups and entrepreneurs because startups and entrepreneurs are the backbone of the Indian economy. You are around 40 to 50% of the GDP is given or generated by the MSMEs. MSMEs, startups and entrepreneurs are the backbone. Now, India, the trend has been changed from job-seeking country to the job provider. India is providing a lot of jobs to the other countries. We are doing everything, whatever we do. That is why all the rules, regulations have been changed and modified as per our requirements. So the approval process and everything is fast. Even in the drug control department, one of the duties, all the regulatory approvals are given a fast track. Due to digitalized India, almost all the regulatory applications to the authorities submitted only to online Sugam portal, and we get all the approvals in time without any delay, so that the research, even the drug development in the pharma industry is very fast when compared to the earlier days. Increased ability to present self in sector of pharmacy profession, concept of laboratory designing, importance. See, everybody knows the importance of pharmacovigilance. There is one more field coming up very promising, that is eco-pharmacovigilance. Eco-pharmacovigilance, it is the impact of unused and expired medicines on the environment. It is our responsibility to teach all the pharmacy graduates or educate all the people what we have to do with the expired and unused medicines Even it can be reused and it can be reprocessed. The formulation can be reprocessed and we can extract API. Recycling of formulations have been developed. Green chemistry is there and solvent-free reactions are there and flow chemistry. Those are the new ways of synthesis and all are preferring green chemistry now. They don't want to go for harmful chemicals. Definitely, after expiry it comes in our tax. Lot of people, even being a pharmacist or pharmacy students, what we will do with our expired and unused medicines? Simple product is thrown in the dustbin or into sink. In turn, it is going to the lake, seas, it is killing lots of marine animals, fish. So many things are happening. So, to avoid all those things, there is one more big area which is eco-pharmacovigilance. We have to address it very, very stringently. And in the new regulations, they are also clearing what we have to do. It is just harming like plastic. Everybody wants to ban plastic, no? It, as a pharmacist, you have to how to control these expired and unused medicines. Earlier case, before GST, big pharma companies used to take back when the near expiry is there, 6 months before we can certify to manufacturers. Now no manufacturer is taking the medicines back because of the competition in the price, because of NPPA, National Pharmaceutical Pricing Authority. The price of medicines are very, very competitive. So they don't want to take it back. They will give to you, it is your responsibility to dispose in the proper way. Then awareness of national health programs is our duty to teach the people. Then service in hospitals and other things. So, what is the role of the teacher during this implementation of national education policy? A group of teachers or a teacher having experts may be engaged to teach those topics. Institute may arrange industry visit already. All colleges are doing this one. Still, it will make a compulsory part to be whenever you go to college in the before final year, compulsory you have to do the minimum training in the industry to get both diploma as well as a degree. Now the second topic is what is restructuring of pharmacy. Actually this is the topic of Naresh Ashija. Due to emergency he is in Delhi. So just I will cover this topic also. Is the restructuring of pharmacy education as per NEP 2020. What will happen? We are just to understand the beauty of after implementation, see key points and the possible solutions which are incorporated by revised academic syllabus. The main advantage of revised NEP is first one, multiple entry and exit. That is the beauty of NEP, New Education Policy. Award of diploma in pharmacy after completing a mandated hospital and domestic training. At this level, students will be able to get registered as a pharmacist. And diploma students are called as pharmacists, not degree or PG. They will be called with different names as the doctors. Form D already they are calling as a doctor of pharmacy. So like that, this will abolish students. After this, even one more dangerous thing, diploma colleges will be closed soon. It is an indication already because this will abolish the need to run diploma in pharmacy programs separately. Definitely, as a journey, because after if you do pharmacy for 2 years, you will already a diploma degree. So there will be no need of diploma colleges. It will also affect in the later stage. For 5 years you won't feel, but in the next definitely in another 4 to 5 years it will impact even diploma courses also. This will be major change in pharmacy academia and shall be placed with mechanism of institutions running diploma in pharmacy. The 4th year to split into, see the beauty after 4th year, you will be honored as D.Pharm honors and D.Pharm research. The honors part should be elective subjects like community pharmacy, industrial pharmacy, retail pharmacy, marketing and management, clinical pharmacy, regulatory pharmacy are the subjects which will improve the skills and interest of students. In this area, they want to work. See, then you are B.Pharm, there is two types of degrees, B.Pharm honors and B.Pharm research. That is B.Pharm honors will include all the hospital pharmacy, retail pharmacy, then your regulatory affairs, all will come under B.Pharm honors. And basically, if you want to involve in research and development, formulation development, or API chemistry, so then you will be in the B.Pharm research. So, what are the multidisciplinary components? What are the new things they added? In pharmacy curriculum, there are already few multidisciplinary subjects covered already. Those are like artificial intelligence. You can learn artificial intelligence in pharmacy, then data analysis, robotics, mechatronics, advanced engineering tools for novel intelligence development. These are the new courses which are already in the pharma syllabus. You can learn all these new courses. See, last week I was with some US clients. They're telling, all are telling were computer science engineers, artificial engineers, then our information engineers. Those are not the basic engineers. They are learning a language like Java, C++, and all those things. Actual engineering codes are different. Civil engineering, architect, mechanical, automotive, those are the actual engineering. They are telling. This is the applied application of one in the trend. Don't think your computer science, artificial engineering, informatics, everything is same, it is only application they learn. And we are thinking, oh, they are doing wonders. No, only pharmacy people will learn a lot of subjects. Along with that, we can also involve in artificial intelligence, robotics. We can change your career. Few of my students who have completed M.Pharm, they are the domain specialists in software companies. See, majority of the software companies want to develop software for pharma industry. They don't know the knowledge of pharmacy. Pharmacy specialists are required in software companies to develop the software domain specialists. In QB, QC, all your softwares are designed under the guidance of a pharmacist. So you can enter into software company now. They told, no, these all the softwares are not specialized for engineers only. Any type of graduate who is having thorough knowledge, what exactly you want to design in your software, you can be a domain specialist. Maybe in Reddy Labs, Hetero, Arvindo, big companies, they started a new area called domain specialist. Namely the pharmacists will guide these software people to design the software. Then language learning and communication skill, one of the advantages they introduced, and all the syllabus will be converted to the local languages, maybe Kannada, Hindi, Marathi, Telugu, entire syllabus you can learn in your own local language. That is one of the beauty of national education policy. Anybody can learn any subjects in their own local language. Then practical and hands-on training, mainly in development of pharmaceutical, mainly in process of computation techniques, manufacturing, research and distribution chain, everything is revolutionized. So you can learn any type of things as the additional optional courses. These are the optional courses which are given as a blessing to the pharma students. Then problem solving and critical thinking. This is a very, very important role. Whenever there is a problem in pharma industry, it is a QA department now, CAPA is there. Corrective and preventive action, change control is there. See, whenever you are doing a regular process during manufacturing, something goes wrong. So immediately you have to take a corrective action and preventive action or change control. Or there is one more thing called as deviation. Some deviations are planned deviation, some are unplanned deviation. You should know how to handle all those things. So you should know how to solve the problem. One more is continuous assessment model. One more is social connect with the field activities. You can go to the field in community pharmacy, medicine, costing, generic versus brand name, and then campus awareness, then your consumer behavior. These are the new upcoming areas for the pharmacy students. So India is considered as the pharmacy of the world for manufacturing. Now it is the next turn. So we can also already, from the students are going to, in hospitals, they are going around with the doctors, and slowly it will change after this correct implementation or perfect implementation will be, you can write your own prescription. The days are very near. Our pharmacy will be there, it will be in par with all the developed Western countries. We can write our own prescription, we can dispense the drug. In European countries, one of my clients will export APIs directly. There, the dispensing system is entirely separate. They will take only the direct APIs based upon your symptoms, body weight, age and sex. They will give the dose of APIs. They will punch the tablet and give to the patient. Maybe diabetes, or anti-malaria, any kind of hypertension. Depending, direct APIs are punched and given to the clients individually. So that is why they will take only bulk drug APIs, no formulation. They will punch there only and they will still dispensing very heavy products in the UK and Europe. It's very good because no, they don't want to formulate and keep the expired drugs. They will take only small quantity, they will formulate and give to the patients. Then, so pharmacy education is popularly known as pharmacists. So this will change very soon. Pharmacists will only be the diploma holders who can run and pharmacy and dispensaries. Others will become doctor in pharmacy or pharmacist in particular subjects. It will change very soon. So there should be separate titles in diploma holders as a pharmacy, degree, some titles like master's, PCI qualified in clinical pharmacist, regulated pharmacist, pharmacovigilance pharmacist, herbal pharmacist, pharmacopharmacist, pharmacologist, and pharmacist. These titles will change very soon, and everybody will know the importance of pharma faculty during the time of COVID. We did a lot of wonderful things. So now, due to this implementation of new NEP, all the BPharm holders will become a specialist in any one area. Only the diploma pharmacy will be called as pharmacist. Now the NEP, which is revolutionizing stepwise, the framework of entire India will change very soon. So lot of pharmacy specialists will come after this implementation of new education policy. See, majority of the MNCs are leaving India. Why? Because there is a three-dimensional growth in Indian pharma sector. The regulatory system in India is very stringent now, and the CDSO, the Control Department, the DCJ, the Control Department of India, the MNC companies are studying in India because one way pharmacy education is developing, they are making entirely different syllabus as per the new education policy. And one more, drug control department people, all the applications are online. They have become very strict and giving approach to the Indian companies. And one more thing, the patent office of India, earlier Novartis, AstraZeneca, GSK, Illinois, they are ruling India past 100 years. Just they want to evergreen their patent. When patent expiry comes, they will do some modification and they will extend the patents. So, because Indian Patent Office has become very stringent now, if there is no efficacy level is increased, they won't give patent extension. So that is why all MNC companies are leaving India now. So why are pharma MNCs reducing India footprint? Major companies like Sanofi, GSK, Johnson & Johnson, majority of the pharma companies are leaving India. They are unable to meet the Indian competitors. Now the domestic pharma chains like Sun Pharma, Reddy Labs, Hetero, Arvindo, Biocon, they are leading the entire world. And now these so-called strong MNCs are making an agreement, a tie-ups in for the distribution of their formulations among the local domestic chains. That is why India has become very strong, and they prove that India is dominating in all the areas. So MNCs are Roche Pharma, lost their case with Biocon, BS lost case with NATCO, and many MNC companies are losing all the patents expiry. After patent expiry, there will be only Indian domestic chains will be ruling the entire world. So they have made a lot of difference in the strategy. That is why Indian pharma sector is growing very, very big, and as a pharmacist, we have a lot of opportunities as well as the responsibilities both. When MNCs tell you there is a lot of gap, suddenly it's our responsibility to hold our nerves and maintain our own standards. So this completes the importance of new education policy. New education policy is very, very blessed, and pharmacy sector will grow like any very big way. That is why they learn, the MNC companies, they have learned a good lesson. And they want to fool us by losing of the patent. When they are losing all the patents and patent office is not granting, that is why they thought, yes, Indian government is supporting Indian companies, not MNCs. So now, with the new regulation, there is a change in new clinical trials, new drugs and clinical trial approvals in India. And earlier, all the medical devices were imported market in India. Now, medical device regulations 2020, they are manufacturing all the medical devices in own India, make in India policy, that they are exporting other countries. In case of cosmetics also, new regulations came. Earlier, cosmetics means we know only Lakme, L'Oreal and few private companies. But now, they are manufacturing our own brands and exporting to other countries. In all areas, take in India, food, drugs, cosmetics, medical device, India is doing wonders in the world. And all that is the reason why all the pharma giants, MNC, earlier people used to tell, I was working in MNC company. See the state of the MNC companies now. All are leaving. You can see the newspaper. It is the newspaper cutting. Last week it was there in the Times of India. You can see that. And recently, regulatory compliance are becoming very, very stringent in India. If they won't follow any norms, they will throw out. Even Paytm, Google, so many cases are there. If you are maybe any company, big or small, if you want to market your drugs in India, you have to follow the rules and regulations of Indian government. It may be Drug and Cosmetics Act, it may be Patent Act. So that is the reason why domestic giants like Sun Pharma, Reddy Labs, GSK, Glenmark, Biocon are growing very, very strong. So with this note, with this positive note, we are very proud to be a pharmacist, and we welcome this new implementation of new pharmacy regulations in India very soon, and we are glad to be here. And once again, I thank Oxford College of Pharmacy for inviting me and recognition from PCI. So thank you.
Any questions from the audience? Now, I request Dr. Parthasarathy sir, Department of Pharmacy Practice, to present token of appreciation to Dr. Sangamesh Puranik sir. I request all the participants to disperse for lunch and assemble back for the third session by 2:30.
Vijay.